Hi, my name is Brittany. I am going to be doing my injection skills today. I will be sure to follow my GPSP guidelines. I have verified my order and gathered my equipment. I will follow my 11 routes and 3 checks. And now I'm going to perform hand hygiene. And put my gloves on. Could I have your name and date of birth?
Yes, May 12, 12/15/93.
Okay, and do you have any allergies?
No.
I have confirmed with the patient's medical records that they have no known allergies. I would do any assessments necessary before giving the injection. First, I will show the injection sites of intradermal, and I would do the inner surface of the forearm. You could do the chest through here, and on the back below the scapula you could do these areas. And for the intramuscular, you would go on you would palpate for the acromion process, do 3 fingers down, make a V, and you would inject right in the middle. You could also, the vastus lateralis, you would have 2 lines vertically, 2 lines horizontal, and then you would inject into the third center of the outer thigh, and sorry, the thigh, and then I would palpate the greater trochanter. And then I would point my index finger towards the anterior superior iliac spine, and I would put my middle finger dorsally, palpating the iliac crest, and I would inject right between my first and middle finger. Then I would do the subcutaneous. The one on the hip is called the ventral gluteal, and then I would do the subcutaneous, which is the outer aspect of the back of the arm, and then I could do the stomach across here, below the coastal margin and above the iliac crest. And then you could do the thigh through here, and the back below the scapula. Now I am going to show how I would perform the injections. Sorry, I'll let you know first.
Okay. That's probably good. You have a sharps container.
Okay. Did you put that on your arm?
Which one do you want to do first?
I'm going to do the IM injection first into the deltoid. And like I said, you would palpate for the acromion process, 3 fingers down, and then inject into the triangle. I will be using a 23 gauge 1-inch needle. I will clean with my wipe in circular motions, and I will allow that to dry. Holding the needle with my dominant hand, I would pull the cap off, turn my medication, and I will go in at a 90-degree angle. I'll inject quickly, or I will insert the needle quickly, inject slowly, and then I will hold that in place for 10 seconds. Then slowly and gently in the same degree that I had put it in. I will apply gentle pressure, being sure to educate the patient not to rub the area. Okay. My patient has another injection for subcutaneous. I will cleanse the site with my alcohol pad, allowing it to dry. For this one, I will be using a 27 gauge. I will be going in at a 45 to 90 degree angle. I am going to hold the skin, and I will release the skin before administering the medication. I will inject slowly over 10 seconds. Then I will remove quickly in the same degree that I had put it in. Now I will be doing my intradermal. I'm cleansing my site in circular motions. I will allow that to dry completely on its own. Holding with my dominant hand, I remove the cap. Okay, going in at a 5 to 15 degree angle, I would have my bevel up. Going in about 1/8 inch. I'll secure it and inject until I see my wheel. I would remove slowly in the same degree that I had injected. Now I will remove my gloves. Perform hand hygiene, and I would report giving this medication immediately. I would report and document, and then I would come back and evaluate my patient's response to this medication. Thank you.